We're back with another episode of Meet St. Tammany, and I really enjoy a conversation. They're just really good, down-to-earth people, and the team at Covington ENT, they're just that. Brad, Monica, and Hailey did a great job explaining their story, talking about their business, and how they can help you with any of your ear, nose, and throat issues. Tune into this episode of Meet St. Tammany. Welcome to Meet St. Tammany. We've got the Covington ENT group.
Yep.
Right? I got that right, didn't I?
The squad.
Yep. Good. Well, we're excited to tell y'all a story. Doc, we get to spend a little bit of time together throughout the year, but I'm excited to just learn more about your practice and the great team that you have here, and tell everybody what ENT actually means, because we all think that, you know, I got a problem with my sore throat, I go see the ENT, but y'all do a lot more than that. So I'm really excited to introduce y'all.
Yeah, absolutely. Thanks for the opportunity, man. We really appreciate the time.
Yeah. So doctor, nurse practitioner, audio specialist, what?
Audiologist.
Audiologist.
Yes.
Yeah, look, I'm
It's
not
a doctor of audio.
There you go.
Yes.
Very cool. So y'all do the full scope, and I think it's important to talk about how y'all go from the children aspect, pediatrics, all the way up to people who are later in the stages in their life and they need hearing aids and all that kind of stuff. So I think that's cool. So what kind of made you get into ENT? What drew you to it while you were in med school, and how did you get here to the Northshore?
Yeah, absolutely. So that's a lot of questions there. I think we got some good answers I can get for you on that one. So from a standpoint of what drew me to it, really part of it is what you talked about. So when I was going through my rotations, I liked everything. I was excited about medicine. I knew I wanted to be a doctor from the time I was really pretty young. Thought it was a cool way to really be able to help people and kind of be involved with the community. And then still also a neat way to be able to use your brain to be able to do that. So when I started doing all these rotations, I did pediatrics, and man, I loved pediatrics. And then I did surgery, and man, I loved surgery. And then I did medicine, and I was like, oh, this is good. I don't know that I love that, but this is good. But all the different aspects, when I sat down and tried to figure out what was going to make the most sense for me, I found ENT. And so it was really kind of a combination of being able to do pediatrics. I mean, I can walk in the room and I'm seeing a 2-day-old baby for an issue with a tongue tie. And then the next room, I'm seeing an 85-year-old person who's having hearing issues. And then I'm seeing a 35-year-old person with sinus issues. So there's a lot of variety in the age groups and the problems that affect them that really kind of keeps the day interesting. And then for me, the fact that it's a surgical subspecialty was a big deal. I like that aspect of it. Medicine's great, but it's really hard for me as a provider if all I did was tell people, here, go try this pill and let's see. And then if you take the pill, it may work, it may not work. The issue with surgery was the aspect of being able to go in and actually fix something with my hands. Yeah. And, you know, ENT's got a huge procedural base. Like most patients that I'm seeing in the office are needing something done, whether it's like a nasal cautery or whether or not we're having to do a maneuver to replace their inner ear crystals to get them back in alignment.
We have crystals?
Yeah.
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 That's a little fancier.
That's the fancy side of ENT. So that's what actually Miss Monica specializes in, that. She loves to do that aspect.
That's why she laughed louder.
Yeah. From a standpoint of kind of what got us here to the North Shore, it's been a journey to get here. So whenever I finished med school and residency, my wife and I actually moved to Lake Charles, had 2 kids there.
That's
we were there for almost.
I thought you were from Lake Charles. My dad's from Lake Charles. My dad's from South Beauregard.
Oh, yeah. I know South Bow. Yeah. So we lived there for almost a decade. I had a good practice there, successful practice. Things were well. And then a hurricane hit there, and we lost our house in the hurricane. And I had already lost my house in Hurricane Katrina because I was there during med school. And I was like, that's it. I'm moving somewhere where there's no hurricanes. Yeah. So my wife and I decided we're going to make this huge life change at 40. We're going to move. All this is going to be so interesting and fun. And we were looking at California. We were looking at South Carolina. I actually had some job opportunities that were lining up in South Carolina. I was pretty sure that's where we were going to move. We were already on like our 3rd visit there. And we're going to fly up there. And we have some friends that live here. And we were staying at their house, good family friends. And all of a sudden we're going to look at houses. And I was like, man, why are they moving? They had this great house by the park. What are we doing? And then so I'm like, man, that's kind of crazy. It's a nice place. My wife's like, well, what do you think about this house? I'm like, man, I guess it's fine.
They're
I don't
really
know.
enjoy it,
they're going to seem like they're going to enjoy it. I like the other place where she's like, no, for us. And I was like, what do you mean for us? And she was like, well, I think I want to move to Covington. And I was like, what? We just left our whole life to move 3.5 hours away. And so, like I said, you know, I wanted to move to Carolina. She wanted to move to Covington. So we compromised and moved to Covington.
Yeah, for sure.
So
It's a way of that happening.
It does, but it worked out great. Really, it's been a dream come true. We found a good fit here for our kids and for ourselves, and really have been able to make a life here in a relative few number of years. We've been here about 5 years, but it's been great. Being able to
we're probably pretty much on the same. I'm in a little bit longer than that, but we're on the same schedule.
Yeah.
And you know what I love about this town? She's been here her whole life. She's from Slidell. Are y'all from up the North Shore too?
Hammond
You from
area.
Slidell too? You from Hammond, America?
The Dell.
Have we met before? I feel like we met each other in another life in the past.
Maybe,
When you said
maybe.
that, I was like, yeah, we've met before. If you come here and you work really hard and you do the right thing, they welcome you with open arms.
Yeah,
they really do.
I do completely agree with that. I think that's a good point about it.
It's
We
been
still remember you're not from here, but we do welcome
for
you.
sure. Yes, that is true. They definitely you have to earn your right to be. I mean, you have to earn the credibility and the value of the community. But if you do the right thing and work hard, I do think there's an opportunity for people over here, no matter whatever business you're in, right?
Yeah.
So I think it's great. And I saw that your wife works with you,
She does.
right?
Yeah, she's actually a nurse. She's an allergy nurse. And when we went back to opening up this practice was her first time to work since we had kids. And so she'd been out of the workforce for almost 10 years, doing a really hard job being a stay-at-home mom, which she tells me every day I should have went back to work 10 years ago.
Yeah.
But so she's actually started working with us. She is the allergy nurse in the practice. So she does the allergy testing with us and does the injections and kind of helps spearhead and run that part of the clinic. So
Cool. So you in online you mentioned several things, right? So y'all do the surgery, you do the medication, the medicine, but you also are meeting with the clients just to get to know them and figure out whether there's a solution to a problem that y'all can even help with, right? And
Yeah.
so what I think is great, and I you see the kind of the turn in medicine at this point where people are trying to be preventative and find an alternative route to medication and trying to do things that may be able to help them in other ways, right? And I think that that's a good place to start because I think the allergy testing is really, really fascinating.
Yeah.
I grew up cutting grass, doing landscaping from the age of like 12 years old until I graduated from high school. And I never had allergy problems until I moved to Baton Rouge. And then like it was like overnight that my every time I'd walk outside, I'd have to use the dirty word Afrin so I could even breathe when I walked out of my house. And I went and got an allergy test done, and I was allergic to every type of grass and pollen at that point in my life. And I don't know how it happened because my whole life I've been in the middle of it. Right?
It wasn't the keg stands.
Maybe me being upside down,
Falling in the grass afterwards.
Exactly, yeah.
My head on the
Yeah.
ground.
That's probably where we knew each other
Yeah,
from.
Because he's doing better now.
Yeah, I'm good. I haven't done a cake stand in a minute, but so like from like the allergy testing, what is the goal of the allergy testing? Is it a completely preventative thing? Do people come in with a lot of symptoms? Like at what point do you think people should come in to talk about that? Let's talk about the allergy testing service you'll start with.
Yeah, for sure. Do you want me to take this or do you want to talk?
Go right ahead. You're doing great.
Thanks, I appreciate it. Oh, you're so sweet. So from an allergy testing standpoint, the goal is for us to figure out kind of what could be creating a lot of the allergic burden. So for a lot of people, it's not necessarily one thing. Like people think that they're going to go have an allergy test and one thing is going to be a huge problem and everything else is not going to be an issue. Most time it's a cumulative effect. There's lots of little things that add up. And so it's about the total amount of allergy in the body, or what we call an IgE, which is a particular type of immunoglobulin or something within the body that creates that allergic response.
Cool.
And so something interesting about allergy, a little different than the question you asked, so I'll get back to that, but something interesting is why when you look at first world countries, we have a much bigger problem with allergy than other third world countries. And a lot of it they think has to do with the fact that IgE, which is the molecule in our body that creates this allergic response, it's originally designed in our body to attack parasites. And so it recognizes foreign invaders and then coats them, creates inflammation in the body so the body can get rid of it. So the problem is the good thing is that we don't have parasites as a main problem anymore.
Yeah.
And so all we have is this IgE production in our body that our body doesn't know what to do with it. And so then all of a sudden it starts recognizing things that are coming into it, allergens, as being foreign. And so it attacks it. But the problem is it's not a worm it's wrapping itself around. It's the entire nasal lining.
Gotcha.
And so then it creates inflammation in the lungs, in the gut. It can do, I mean, it's not, allergy doesn't just, confine to here. It's got, effects.
So long
throughout the
story
body.
short, we all need worms.
Yeah.
That's what we're getting at, right?
Well, weight loss, allergy, inflammation.
Caused a lot more problems than it benefits.
Yeah.
But I think that at least for me, and even my dad being a physician, right? Like we're always treating the problem right at the moment, but we're not actually treating the source of the problem, right? I mean, if I wake up one night and I'm stuffy, I take the Afrin, I can sleep because I can breathe, right? But I don't necessarily know what caused it. And you're telling me that I could spot the issue ahead of time and do things to prevent it even from coming on in that capacity.
Yeah, and the only option or potential for a cure from allergy, the only one that we know of, is really desensitization. And that's where something like allergy shots or drops or toothpaste, which are other forms of desensitization that we offer in our clinic, can reduce and change that IgE that we were just talking about to an IgG, which is a type of antibody that doesn't cause that inflammation.
Yeah.
And so really it's the only way that we know that can do that. Medicines, they block a symptom. So you take a steroid, it's going to block the inflammation. You take an antihistamine, it blocks the histamine release. So really, that is the only way to try and break that cycle of continuous usage of medication. And then really looking lifelong. When you're talking about, never having a problem, it's not unusual in your early 20s to develop a peak of allergy. So you don't have to have had allergy problems your whole life. We have patients that are coming to see us at 60 years old and all of a sudden starting to have allergy issues. And that's when we also look at other parts about diet and inflammation in their whole body and kind of going through that cascade with them and really trying to take the time to figure out what the underlying cause is. Sometimes people come in and they think they're having allergy and it's not allergy at all. It's acid reflux, which can mimic a lot of the same symptoms. So there's lots of other ways that you come in. When you come see Monica or myself, you're definitely not just getting, here's allergy testing, here's drops and shots and go away.
Yeah.
We really spend some time trying to figure out what the underlying root cause is, whether it even seems like allergy, or if it doesn't, then we help you get to the right place if it's not with us to figure out what the next steps are.
Like the goal from a patient walking in y'all's clinic, is it to walk out in a year and not have any allergy symptoms, or really to understand how to control the reaction you're having to it, right?
Yeah.
So allergy shots help to selectively modify the way your body responds to your environment. So we find out what it is in your environments that's triggering such a widespread response. And we're trying to take your response from way up here to a normal response. And that takes time because you don't just change the way your immune system responds to your environment overnight. So it can take anywhere from 3 to 5 years, but we can desensitize, we can teach your body to stop responding hyperactively to those things in your environment that trigger it.
So like the long-term result of a client who comes to you guys who might their whole life just been masking the symptoms with some sort of over-the-counter medication would be to get these allergy tests, figure out what the root cause is, and then to over time reduce your body's reaction to that so that they don't have that same need for the medication over the counter.
You nailed it. And it doesn't take that long to really get symptom relief. It takes that long to get lasting results.
Yeah.
And so, if you do allergy shots and you're feeling good and then after a year you stop, the symptoms are going to come back. The several studies have shown that it takes that 3 to 5 year mark to really get those long lasting results, like lifetime. And then after that, you can evaluate, do I still need to be on these? What, do I need to have repeat testing? Kind of where we go from here. And it's not just hanging out in the interim until that happens. We have medicines we can use to help, naturopathic things like sinus rinses and honey and other things that we can do to help along the journey. And then really making sure that is the primary issue too, which I think is an important thing. A lot of people come in and, I have sinus. What does that mean? I have a headache. Or where's your headache located? Well, it's located here in my temples. And it's probably not sinus. It's probably stress. You're probably clenching your teeth. That creates facial pain. Same symptoms, but different backstory.
Yeah.
And so learning that backstory.
Hey, where was that?
Yeah.
I know.
Right?
I know. Yeah.
Right?
I don't have a sinus problem. I have a stress
Yeah.
problem.
Yeah, absolutely. So does most people.
It's good that I keep my hair in this tight bun all day.
It's the man bun for sure.
All right, cool. Let's shift to another area because we all have young kids, and I've had to go through the tonsils and the tubes and all that type of stuff. Right? I know y'all do the tubes. Y'all doing the tonsils too?
Oh yeah, for sure.
Gotta do the tubes and tonsils. My daughters were like touching each other. The tonsils whenever
we call those kissing.
Yeah, it was. The tubes were easy to deal with after it was like an hour or two in my we did them on the same day. I thought that was crazy.
Yeah.
I did both tubes on one and tonsils on the same day.
Yeah.
But after the tubes were in for a little bit, my second daughter was fine. The tonsils were brutal. My wife got them out when she was 20 years old. So
that's
that
really
was
rough.
It was really rough.
Yeah.
But so what's y'all's process for doing that, right? Y'all work with pediatrics, peds across the pediatricians across the parish, and they refer y'all the young kids, right? Yeah. How early do y'all usually see kids coming in right now to get that type of stuff done?
From a standpoint of tubes, that usually starts off sometime around 6 months is usually by the point they're meeting criteria, because it's not 1 to 2 infections then you put in tubes. Usually we're somewhere around that in the first year of life, 5 to 7 year infections requiring antibiotics before you're going to use tubes. Yeah. Unless they're having like really high fevers or some other indication that you might need to, progress that a little bit quicker. And yeah, we work with several good pediatricians in the area that send us a lot of referrals, but a lot of it's also just word of mouth.
Yeah.
This Mandeville Moms group has quite a bit of
They're
power.
powerful. They are powerful women right there. They got Slidell mommies too,
Yeah, I know. That's what I'm saying.
It's a thing.
I definitely think that having a good bedside manner has helped us. And Monica's really helped us grow the practice as well, as she came in and brought a lot of people with her from her 20 plus years of ENT experience, and then just her knowledge of being in the community for a long time. I mean, she's been a lifelong resident here, and then, working in the different places that she's worked has really allowed her to build a presence here. Plus, she's just a really nice person. So it really does help kind of grow that portion of our practice. And then from the pediatric standpoint, Dr. Baldwin, Hailey also can test pediatric patients from a hearing loss standpoint. So we can kind of take care of the issue, because a lot of times it's not even ear infections that bring kids in for tubes. It's like, my baby's not really talking yet.
Yeah.
You know, like, do you think it's a speech issue? Do you think it's a hearing issue? Do you think they're having fluid buildup behind your ears and we need to consider something like ear tubes, you know? And I feel like that's one of the ways that really in our practice, you can come in and we can kind of assess that on multiple levels with an in-office audiologist, you know, with somebody with lots of pediatric experience. And then with myself from a pediatric and a surgical standpoint, I feel like that's one way that we really take care of the peds. And we kind of cater to the kids in our office. One of my favorite parts of my practice, really. Probably 50% of what we see is pediatrics.
Nice.
And so I love it, man, from the conversations with them. And they're always honest. Like, you can ask a kid anything and they're going to tell you. So there's no like malingering or trying to get something out of you. They just want to get a sucker and go home.
Yeah,
that's all they really want to do.
You can bribe my daughter with a sucker and she'll do pretty much anything.
The power of candy,
It's
man.
crazy.
We definitely embrace that. We're not dentists, so we don't have a problem with that.
She had not hit the ball.
Afrin, no. Sucker, yes.
Yes.
She had not hit the ball over the net yesterday in their volleyball match, and I looked at her and said, "If you hit it over the net, I will give you a piece of candy." And the next one that came to her, she got over the damn net. I'm telling you.
Did she run out of the game
Oh,
to get a
she was so
game?
excited. I mean, she was like holding me accountable. We're going right now.
Yeah, I need that candy.
Yeah, she was excited. I was going to transition. I'm glad that you brought up the audiology side, because I didn't know anything that was going on whenever my kids were born. Like my father-in-law's an
Shocked.
OBGYN.
I'm shocked.
No clue.
Young
Okay.
father, shocked.
So like this person comes in with these things, they start putting it on my kid's head, and then Stephanie knew it was happening. I didn't. She was all fired up whenever they checked all the boxes, and then all my kids could hear.
Yeah.
Thank goodness. But y'all deal with children who have hearing problems, I'm sure. What does
Yes.
that process look like? Are you going to the hospital and doing the test?
No,
they
no.
come to you
So
after.
correct. So I mean, we see as little as a few days old, a week old. A lot of those kids get tested, yes, in the hospital. So it's done. They're checked off. They're good until we see other issues. But some people who do home births, that's a popular thing now, or like medical centers who don't have the hearing test or whatever. They come and see me, and what they do in the test is otoacoustic emissions, OAEs. So basically it checks about 12 different frequencies. And it sends this frequency in the ear and it measures what comes back. And it basically gives us a checkbox. Are they hearing here or are they not? And usually that's a pass or fail thing. And then of course we check tympanometry. That's checking for fluid in the middle ear. If that's the case, then if it's something that's, infected and whatnot, they get on antibiotics, get stuff like that. And then, of course, depending on the age. So little bitty, those are about the only two tests you can do in office. Once they hit about 1.5 to 2 years, we can do like sound field audiometry or VRA. And so basically, we play different sounds in the booth and they turn their head. We light up a toy for, entertainment purposes. But yeah, that's kind of the process. And I mean, we see them as little as a couple weeks, few days, all the way up to 100 years old.
I've heard some pretty crazy things about kids nowadays that like are almost deaf. They're missing some main function in their ear, and then there's some things you can put in and they can hear and turn the on and off the switch to hear.
Yes and no. So if they're born, without hearing, they don't have like the cochlear hair cells are working correctly. Yeah. So they do have cochlear implants. So we don't particularly do those in our office, but so basically there's an electrode that goes through the inner ear, goes through the whole cochlea. And then there's something that attaches to the side of their head on the mastoid. And basically that's how sound gets processed through their ear. It bypasses the inner ear completely and just goes up the nerve.
That's pretty wild.
To the brain.
That is pretty
It's
wild.
crazy. We've almost eliminated that loss of sense. You know what I mean? Like, it'd be like if you could create fake eyeballs for people that can't see.
Yeah.
Right.
We really have been able to do that. And I think, Hailey brought up a good point. That isn't something we necessarily do directly in our office. But a lot of times we serve as the gatekeeper to other subspecialists within ENT.
Cool.
So ENT is a kind of otolaryngology. It's a generalized study of the kind of head and neck. And then there's also like head and neck oncology surgeons. There's otologists that do the cochlear implants. And we've got the contact with the experience between Monica and I, 40 plus years of doing ENT, to be able to get patients kind of shifted to places that they need to be to make sure they're getting the care they require. Because sometimes they don't really know where to go. Like, they just know that there's an issue. Like, what do I need to do? Pediatrician may say, hey, go see the ENT. And then we definitely are heavily involved in figuring out what's going to be the next best appropriate place to be. It's not like if we can't take care of the problem that we would ever be like, okay, sorry, it's not us. You know, we try to figure out where to get patients for the next level.
Yeah, we relate to that a lot. I mean, we have a lot of business clients who come in and we evaluate their business, and if they have a tax issue or a bankruptcy issue or something like that, we know the people who specialize in those types of things. We'll get them sent over there. So that's great. So I'm probably gonna be a patient at some point in my life because my whole life been grew up duck hunting, and my dad's gonna be upset that I said this on camera, but he never handed out ear protection.
Right.
We were shooting weapons, right? And like
I don't believe it. I know Mr. Mike. I think that you just resisted
that's
wearing
the one
them.
thing he never gave much concern about.
Right.
And I have a ring in my ear all the time, and I'm like 90% positive that it's because growing up I just had 12 gauge shotgun blast going outside of my head. So how early do you see people come in that need hearing aids?
I would say the youngest patient I have right now who's in hearing aids is about 7. Now, of course, they can be fit way earlier than that. I don't specialize particularly in peds. I usually send them to children's or, somewhere a little bit more specialized in that. But yeah, I mean, and most of these kiddos are not from, they shot a gun one time all of a sudden this went out. This is usually genetic factors or several sets of tubes and their ears just never healed correctly, or, a lot of scar tissue and stuff like that, or just, genetic factors, unfortunately, just didn't play in their card. But I mean, I would say my youngest is about 6 or 7, but I have many like preteen teenagers.
And the technology for the hearing aids now is pretty incredible, right?
Oh, yeah.
It's like, what does that even look like nowadays?
So they're itty bitty. So there's 2 styles. There's obviously behind the ear and in the ear. Behind the ear are my preferred, and I think most audiologists prefer, but they just literally sit on top of the ear. They're probably only about an inch and a half long. There's a thin little wire that runs down the side of the face, and then just like a little rubber earbud that sticks in the ear. And so the sound gets processed up here on the top through the hearing aid, down the tube, and then into the ear. And so most adults, teens plus, we fit, that's the typical style. Little bitty kids, typically we do a bigger behind the ear plus an ear mold. That's to protect their ear, if they get hit playing sports and stuff like that. And then, of course, in the ear style, just one kind of solid earplug looking piece. And that's, a lot of people lean towards that style because of appearance. They think those are going to be the tiniest, most inconspicuous, but to be honest, they're really not. And honestly, the features with hearing aids now, the Bluetooth, the rechargeability, the X, Y, and Z, everybody wants all the things.
Yeah.
And the things that the hearing aid that's going to check all those boxes are going to be the behind the ear more than the in the ear style. And a lot of my patients are shocked when I show them. I either put it on my ear or and they're like, that's it? Because they did. I mean, they used to be big and they still make some big honkers, but for most people, you don't need them.
Very cool.
Yep.
Technical, the honkers.
Yes.
That's that Hammond.
Hammond USA.
Right.
Sometimes I go to look in a patient's ears and I can't see in the ear because they're wearing hearing aids and I didn't even see it. And I do this for a living. I'm like, oh, let me move this hearing aid out there. I don't even see it until you get right up on them. You can't even see it.
Sometimes people come in and I'm looking at them. I'm like, great, there's an issue with the hearing aid. They don't have them in. And I'm like, so what's going on? They're like, nothing. Everything's great. And I'm like, oh, okay. Let me see them then. You can't even see them.
Yeah. Well, that's great. Well, like maybe when I'm 40 and I have to get my hearing aids in, then I won't feel so self-conscious about it.
How you did that when I'm 40.
Like
you.
Quite
the
there.
40s.
Holding on.
I have friends in
with
this
your
room,
fingernails
okay?
and your toenails.
It was like I'm gonna be 38 this year, and I was thinking to myself, that is really close to 40. It's the first time I felt like I was.
You'll be all right, bro.
You'll make it.
I'll be all right. I think I'll be a good 40-year-old. So last thing, right? We talked about the pediatrics, talked about the allergies and the audio stuff, but the surgery side, right?
Mm-hmm. Yeah.
So you've been doing this for a long time. You've been doing it for 5 years here. But what about the surgery process do y'all do differently, maybe, or what part of that experience do you enjoy the most?
Yeah. I guess from a surgical aspect, I enjoy being in the surgery the most. I mean, really, I enjoy the technical hands-on aspect, the getting to use the skill set that you've developed over a long period of time. And sometimes it's funny, I get done with the case and I'm like, man, I think that case would have gone a lot differently 15 years ago when I started this, or 20 years ago when I started this. I'm sure y'all have the same thing in your practice all the time. But I think kind of one of the things that really, I don't know if I'd use the word sets us apart, but one of the things that I'm really proud about from our practice standpoint is our preoperative counseling with patients. The amount of time that we spend, like you're meeting with a set of parents. For me, a set of ear tubes is quick. It's an easy procedure. Doesn't seem like it would be that complicated or anything to worry about, but you still have to spend 35 minutes explaining to the set of parents why their baby needs a 3-minute procedure. And it's really being willing to take that time and sit back and say, okay, this is the 500,000th time I've had this conversation. But for you, it's your first time.
Sure.
For you, it's the first time you've heard it, and it's your baby. And
You're
so
terrified.
you're worried and you're scared and you're, all of those other aspects I feel like are one of the things that, and I've heard Monica giving her preoperative counseling. I know what mine's like. And I feel like that's one way that our practice just does a really good job with the peds. And then with adults, it's also understanding scheduling issues, understanding other aspects of life. We do surgery every week. So I have block time every week where that surgery time is offered. But sometimes we have to go outside of that. And if for nothing else, because the patient can't make it work on that day.
Yeah, sure.
So we modify our schedule and do other things to try to make that work for them. But I really feel like that preoperative counseling and time you spend with the patient and giving them an opportunity to answer their questions. And sometimes you have to see these parents 2 or 3 times to answer questions about a set of tubes on their kid. That seems like it should be very straightforward, but when it's your kid, sometimes it's hard to even remember what you talked about when you're sitting there talking for a while.
Of course. Yeah.
I think that's something that we do really well. And then also kind of knowing what I'm good at surgically and staying to those things.
Yeah.
Like I don't try to cowboy things. I do the things that I know I do well. And I have no problem if I feel like there's some better place for someone to be for a particular procedure to say, hey, look, you know what? I haven't done that procedure in 3 years, but I know somebody that does them every week. Let me get you with that person, because the ultimate goal is to make the patient better.
For sure.
So,
Yeah. How many times do you have to have the conversation about the tube fell out of the ear and what is this thing that came out of my kid's head?
getting wax out of kids' ears, just all kinds of stuff. It's the great and the hard thing about ENT. Like you can go from unfortunately having to give someone really bad news that they have a head and neck cancer to spending 20 minutes digging wax out of Pawpaw's ear that's 94 and can't hear. I mean, it happens back to back, just like that.
Yeah.
So
Yeah. That's
20 years ago, when I first started in ENT, we had to take a lot of people to the operating room to fix their problems with, nasal breathing. And nowadays, it's amazing the number of things we can offer in the office. No anesthesia. We don't have to take them to the operating room. We don't have to book an OR or involve an anesthesiologist. And he can fix their nasal obstruction in the office without having to go through, and that was almost unheard of 20 years ago.
Sure, yeah.
So it's amazing, all the advances and the things that he can offer patients now in the office.
That's great. Y'all are really easy to interview because y'all transition to the next point I'm going to make before I even get there. Because y'all have a beautiful office right around the corner from our office in Covington, and I know it's convenient because our office is convenient to get to because it's right there. But y'all did a great job. I mean, every time you drive by it, you didn't notice the building until y'all got your hands on it, and now you've renovated. It looks nice. How does that set y'all's practice apart? Because I know we're proud of our building. I'm sure y'all are proud of what y'all have over there.
Yeah, man, absolutely. I thought of that when we walked in your building today. I was like, man, this place is really nice. It's a cool use of the space. But same thing. We worked with a designer here that really kind of helped capture the vibe that I was going for with the clinic. My idea is that I want it all to feel clean and friendly and almost like a spa when you walk in.
Yeah.
Like everything's done in very muted colors with good lighting. And the idea and the concept is, look, it's already anxiety provoking enough coming to a doctor, especially if you're coming with your child or with yourself and you're not really sure what's going on. We try to make it as soothing and as welcoming as you can. Every point of contact in my practice, we have really strive to create a team that makes you feel welcome during that point. From when you walk in the front door to the time you leave, you should meet smiling faces. You should meet people that are happy to be there and help take care of you. And even the lady that answers our phone, she's got such a great voice and personality. And that makes a huge difference to me as an employer, but then also to a patient.
Yeah.
I think it makes a really big difference when multiple points of contact seem to be happy. And we try to create a good work environment. Like we laugh a lot, we cut up a lot, but we also take care of people.
Yeah.
And I feel like people see that. Like when they see an environment where people are comfortable and they can really be themselves in that environment, we find out where each employee really kind of strives as well and let them do that portion of our daily function a little bit better. I feel like it just creates a better environment for all of us, for the people that work there and the people that come
100%.
there.
She always says, preach the gospel daily when necessary, use word. Right?
Yeah.
The way that you operate your business, the way you carry yourself, the way your office looks, shows your standard and your values without having to be writing them on the wall or yelling at them every time somebody walks in the door or calls you. So I think it's great. If you need an ENT, These are the guys to go visit.
Absolutely happy.
Thank
to
y'all
take
for
care of.
speaking non-doctor language. Y'all are excellent at that. I was like, yeah, their consultations are good. I understand everything that's happening.
We
Y'all did-
appreciate the time.
Y'all did a great job. Katie has all kind of good stuff to share now on social
Thanks.
media. So thanks, guys.
Awesome, man. We really do
Thank
appreciate
you.
it.